Hey, this is Dr. Kamel again, and a new content related to physical therapy education and and preparation for BT license exam. If you didn't watch any of my videos, my name is Dr. Kamel. I'm working as an associate professor of physical therapy in the United States, and I'm a registered licensed physical therapist in the United States, in Egypt, and in the UK. I have got my PhD from University of Nottingham from the UK. So let's go and see what is today's content about. A 50-year-old patient had an uncomplicated open repair of a rotator cuff tear 2 weeks ago. Okay, so now we have a patient had rotator cuff tear or injury or whatever, and then it was repaired surgically 2 weeks ago, recent time. Okay, and we know we have rehabilitation protocols for every case, and I have posted some videos related to rehabilitation protocols. If you have time, please go and watch them. The patient asks the physical therapist when the shoulder will be normal again. This is a very normal question every patient will ask. Which of the following expected outcome time frames most accurately addresses this patient's question? What would be my answer to this patient? So the patient is just 2 weeks post-surgical repair of rotator cuff tear. Number one, I will tell the patient 3 weeks to lift a 5 pound, which about 2.3 kilograms object. 3 weeks to sleep on the involved side. 3 months is to lift the upper extremity overhead to reach into a cabinet. 3 months is to play golf. Yeah. So let's go ahead and explore these options. The correct answer is number three. I will let the patient know that approximately 3 months is to lift the upper extremity overhead to reach into a cabinet. So why this option is correct? After an open rotator cuff repair, healing and functional recovery occur gradually. Okay, we know that. And are directed by tendon to bone healing because these rotator cuff muscles are attached to bone. We all know that, which is slow and biologically limited. At 2 weeks post-operative, the patient is still in the protected phase. I told you we have rehab protocols for post-surgical recovery or post-surgical rehabilitation. The question asks when the shoulder will be normal again, which refers to functional use in daily activities, activities of daily living, not high level or resisted tasks. Okay, we just need normal use of the arm and shoulder in activities of daily living. So, tendon to bone healing typically requires about 10 to 12 weeks, which is almost 3 months. Okay, so my typical answer will be by 3 months. Most patients can actively elevate the arm, perform light overhead activities of daily living, reaching into a cabinet. So this is a realistic goal or realistic milestone, which means that the patient will return to functional shoulder use in activities of daily living. I don't mean here resistance, full strength, stuff like that. No, I don't mean that. I mean only functional activities of daily living, which is like active, free motions mostly. Okay. So the other option, 3 weeks is too early to lift 5 pounds, 2.3 kilograms object. 3 weeks, is too early also, to sleep on the involved side. And 3 months is too early to play golf as well. But usually about 8 to 12 weeks again, if the patient had or has no complication after the surgery or uncomplicated recovery, we mean that. So the patient will be actively able to elevate the arm to functional heights in 3 months. So again, 3 weeks is too early, too early for resisted lifting because this is resisted lifting is involving lifting a weight, and the strengthening is typically will be delayed or starting doing any resistance or minimal resistance exercise by until 6 to 8 weeks. So now we are at 2 weeks post-operative. Lifting at 3 weeks is a risk. Why? Because there might be another injury or re-tear of the repaired tendon. How about the other option? Option two, 3 weeks to sleep on the involved side. Sleeping on the surgical side is usually not recommended and will be uncomfortable for few months. Many patients will not be able actually to sleep on this repaired side or to relate this until about oh, usually more than 12 weeks, more than 3 months. Why? Because if they sleep on that side, they will get pain, and it will be this pain will be disturbing their sleep, so it is not recommended. Okay, so uh, option four, 3 months is to play golf, too early. Playing golf requires actually rotational torque, coordinated strengths, higher shoulder demand. So putting too much stress on the shoulder, and this is usually about 4 to 6 months, and sometimes may take longer time depending on the course of recovery. Okay. So if you would like, to today's question about rehabilitation protocol, musculoskeletal content. If you would like to join my course, which will prepare you to be a good physical therapist, and also taking the license exams, and I have actually a range of graduates from newly graduates uh, until people who are in their 40s and 50s. So it is not never too early and it is never too late. At the same time, if you would like to apply and join the transitional DBT degree at University of Montana, United States, we can get you enrolled at discounted rate. Either way, please send me a message to my WhatsApp number 00144224872060, 00201027743702. And please don't forget to subscribe to my channel and inform other people about the channel, which will be much appreciated. Thank you so much and see you in a new content very soon.